Did you know that there are sticky, slow-growing neuroendocrine tumors that can disrupt lives with hormone overproduction and mysterious symptoms? These are called carcinoid tumors, which affect the gut, lungs, and sometimes even the heart. These tumors might be rare, but the impact enormous. While the cause of these tumors are uncertain, carcinoid tumor research is catching the attention of innovators and investors like us here at Evergrowth. Think AI-powered liquid biopsy, next-generation gene sequencing, and advanced radionuclide therapies. These cutting-edge innovations are changing the game.
I'm Christina Bear. Welcome to today's Business Minute.
Emerging biotech hedge fund, Evergrowth Biohealthcare Capital. We invest mainly in young growth biotech company that have their lead drug in the preclinical stage or early product stage because they have much more growth potential. There are new gene therapy being approved, gene editing drug, and then also innovative drugs to treat obesity, to treat diabetes, to treat liver condition, and also many novel or new drugs to treat cancer. Now, by investing in companies that are at the forefront of such innovation, we support the cause that will continue to deliver the hope and new drug and new technology that ultimately improve the quality of life for the patient.
In our binary event forecasting strategy, we have a very high success rate, over 80% success rate. And by utilizing that, we get able to position out properly and take advantage of those opportunities.
Within 6 months, we have an over 40% return. So in the coming year, there's a chance of even grow up to multiple year-fold in a very short time.
Welcome to this week's Open Mic webinar. Here I'm going to share with you a brief overview of what I share or presented with members of our leadership team. Today I'm substituting for our chairman of the Medical and Scientific Advisory Committee, Dr. Van Nguyen. He's a cardiologist working with Baycare Medical Group, one of the largest hospital group down in southern Florida. So I first went over the definition of carcinoid tumor, and this tumor is a type of slow-growing neuroendocrine tumor originating in the enterochromaffin cells. So this cancer, this tumor or the cancer, they arise from the neuroendocrine cells. So these cells, they are situated in different parts of the body, like in the thymus, the kidney, the liver, the prostate, the cervix, ovary, and the testes. And these cells are the cells that will secrete the hormone based on the signal from the nervous system or the nerve cells. The cause for neuroendocrine tumor is unknown. We have different theories, but there's no specific pinpoint cause for this condition. We don't know the exact cause for this condition, this cancer, but it's likely to have a combination of genetic and environment. They show the two types of carcinoid tumor of the lung. The type 1 or the low-grade carcinoid, the cells look very much like normal cells. They're slow growing. But for the atypical and intermediate grade carcinoid, here the cell, as you can see, the shape it's not uniform. There's different shape. The shape look weird, and with this type, it can grow and spread pretty quickly. This slide shows you the carcinoid symptom, which is based on the different organ system that are being affected. If this is affecting the lungs right here, then you can expect to see the patient to have a lot of wheezing. If it affects the GI tract, a patient will have diarrhea, for example. And then discuss about the type of neuroendocrine tumor, and with GI or gastrointestinal tract being the most common. You can also have those that affect the lungs as well as in other rare locations like the thymus. Effect on the body is mostly due to the overproduction of rather over-secretion of the hormone. That causes the carcinoid syndrome like flushing, wheezing, for example. And then other effect on the body is that as the tumor grows large, they can also obstruct and cause damage to other normal organs in the human body. Since this neuroendocrine cells will release the hormone in response to signal from the nerve or the nervous system, then they will start to secrete a lot of these hormones. So the effect on the body will be depending on an excessive secretion of hormone from this tumor, which will cause the carcinoid syndrome. This condition, as you can appreciate, it is a rare condition, an orphan condition. By that definition, it affects less than 200,000 people in the USA annually, but its global impact, we do not know precisely. Again, symptom for carcinoid tumor, as I went over, is flushing, diarrhea, abdominal pain, and wheezing, and the symptoms reflect the overproduction or oversecretion of the hormone from the various organ system in the body. They can also have other signs like heart valve lesion, telangiectasia, also an enlarged liver or hepatomegaly. A typical symptom of carcinoid tumor is flushing, diarrhea, abdominal pain, and wheezing, which indicate the different area or different organ in the body that it hits. A sign and symptom of this, if it hit the liver, you can have hepatomegaly, heart valve lesion, telangiectasia. For confirmation of the diagnosis, we'll do biopsy, and then with biopsy, the pathologist will look under the slide to see the specific cell type that are or specific tissue that are being affected to give confirmation or definitive diagnosis. And a key diagnosis for this condition is the 24 urine test for the presence of this metabolite, the 5-HIAA. We also do blood tests for hormone A levels, and also for confirmation of the diagnosis, we do like a biopsy to get the histology so that we know the specific type of the tumor, like in the lung, for example. In terms of treatment and outcome, which I went over next, a mainstay treatment is surgery or surgical removal of the tumor if it's still localized or if it still stay at the area. But if it's metastasized or moved to other area, then we need to shrink it before we can surgically remove them. And then I also discuss other therapy like targeted therapy with everolimus, also with PRRT, peptide receptor radionuclide therapy. I know the name is a handful, but basically we attach a radioactive isotope to a peptide, and then that peptide will have specific binding to a target, which is a receptor on the cancer cell. So that way the cancer destruction is very specific and also precise. We then discuss about new medical trend like with liquid biopsy to detect for fragment of the circulating tumor cells that would allow us to detect this disease much faster. We also discuss about next generation sequencing to look at personalized medicine, also advanced PRRT with novel radio isotope to boost the efficacy. So with liquid biopsy, you take a blood test and then run that through the lab, and then in the laboratory analysis, will detect for certain circulating fragment of the cancer DNA or certain marker that allow us to have a diagnosis of the cancer. And then of course we have to confirm the diagnosis with biopsy and imaging, so on and so forth. Next we discuss about the different commonly prescribed medication like octreotide, lanreotide, as well as other medication for symptom control. Commonly prescribed medication symptom control is very big for carcinoid syndrome. So octreotide, lanreotide will help with symptom control like diarrhea, for example, interferon for immune modulation. And that concludes my presentation.
If you want to capture this lucrative opportunity while investing in the innovation that deliver hope to the patient, but you either don't have time or you don't have the expertise, reach out to us, contact us. We'll schedule a call to see if we are the right fit for each other.